Today I would like to describe the normal versus abnormal liver image on the ultrasound. You can see that in the first image this is normal equidensity of liver. In the second image there is diffuse increased equidensity of the liver consistent with grade 1 fatty liver. This is the grade 2 fatty liver with loss of the normal equidensity of the portal vein branches. In the fourth image, there's a loss of the diaphragmatic contour. You cannot see the diaphragm here. This is the grade 3 fatty liver. Normal, grade 1, grade 2, and grade 3. This is the right lobe of the liver, in which you can see that this is a simple hepatic cyst. Simple hepatic cyst, you can see this in the right lobe of the liver. This can produce the posterior caustic shadowing, and appearance is simple. This is the simple hepatic cyst. This is the right lobe. In this image, you can show that this is the hyperechoic lesion in the right lobe of the liver. This mainly echogenic lesion in the right lobe of the liver is the hemangioma of the liver. Hemangioma of the liver. This is the case of the hepatocellular carcinoma. You can see the heterogeneous mass in the right lobe of the liver with variable echogenicity. You cannot label the hepatocellular carcinoma on the ultrasound image. You have to do the CT scan of the abdomen with contrast triphasic scan. Triphasic mean arterial phase, venous phase, and delayed phase. This is the HCC in the right lobe of the liver. You can see the heterogeneity of the hepatic lesion. In this image, you can see that there are multiple lesions in the right lobe of the liver. These are giving the you can see that there is a hypoechoic halo with the echogenic center. So this is the typical case of the metastasis to the liver. Metastasis can present with the this lesion, like the peripheral halo with the central echogenicity, and they can also present with the cystic appearance, or they can also appear as the hyperechoic lesion, but multiplicity is the common. CT scan of the abdomen is also advised for this to differentiate these lesions. These are the mostly metastasis to the liver. This is the hypoechoic lesion in the right lobe of the liver. Most likely, this is the hepatic adenoma. For this, the CT scan of the abdomen is advised. You cannot differentiate this lesion from the ICC on the uh, simple abdominal ultrasound. For this, you have to do the CT scan and MRI. This is the case of the hepatic adenoma. This is seen in the patient who are taking the oral contraceptive pills, also taking the steroids. This is another lesion in the right lobe of the liver. You can see the multiple cysts, multicystic lesion, or you can see the different cysts in the right lobe of the liver. This is the mass with the multicystic appearance. This is most likely head cyst with the daughter cyst. You can see that these are the daughter cyst. The case of the head cyst of the liver. Head cysts of the liver appear with the different appearance. Most likely they present with the multicystic mass with the most likely presenting daughter cyst. Also, they can appear as the floating membrane like the water lily signs, and mostly the lesions are complex appearance. while in the simple cyst, only the cystic lesion, simple cystic lesion is noted. So this is the case of the hydrated cyst of the liver. This is also case of the hydrated cyst of the liver. On the ultrasound in the right lobe of the liver, you can see the floating membrane in the cystic lesion. Mostly this is called the detached membrane, which is called the water lily sign. So this is case of the hydrated cyst of the liver. This is another case when we see, you can see the cirrhotic liver with irregular margins and nodular appearance, and this is case of the cirrhosis of the liver. Cirrhosis showing irregular nodular liver surface and the rough edges. Rough edges. This is the case of the cirrhosis of the liver. In this case, you can see that there are three hepatic veins are shown: one, two, three, right, middle, and left hepatic vein. So basically, purpose of this image is to show you the anatomy of the hepatic segment of the liver. This is the on the right this is right hepatic vein. On this side, this is the segment 7. Between right and middle hepatic vein 6. The middle and left hepatic vein 4. On the left side of the left hepatic vein, this is the segment 2. So these are the segments of the liver on the ultrasound. This is another case of the ultrasound image of the hepatic vein. You can see there is thrombosis of the portal vein. You can see that this is the echogenic material is noted inside the right hepatic vein. Thrombosis of the right hepatic veins. This is seen in case of the Budd-Chiari syndrome. This is the right hepatic vein, middle and left, which is not clearly shown. This is the thrombosis in the right hepatic vein. This is another case of the mass in the liver, right lobe. You can see that this is the spoke wheel pattern of the color Doppler image. On color Doppler, spoke wheel pattern of the color imaging is noted. Basically, this is case of the focal nodular hyperplasia. The mass can have variable appearance. These can be mostly hyperquake, isoquake, can be hyperquake, but mostly they are hyperquake in the appearance. They can have the central scar appearance like fibrolaminar hepatocellular carcinoma, FHC, and FNH may have the uh, corresponding appearance. So the next step is the CT scan and MRI to differentiate them. But on the color Doppler study, this is the mass. You can see the spoke wheel pattern of the on the color Doppler image of the variable appearance. You can see that this is case of the FNH. This is the case of the dilated hepatic vein seen in case of the congestive cardiac failure. Hepatic vein, this is right hepatic vein, middle and left hepatic vein. Their size is normally, right hepatic vein size is normally 6 mm. More than 11 mm, it is considered abnormal. Also, the IVC is also dilated in case of the congestive cardiac failure. Dilated hepatic veins. So while you are doing the ultrasound of the liver, you should also comment on these hepatic veins. Their dilation is associated with the congestive cardiac failure. This is the case of the portal hypertension in which the portal vein is dilated. Portal vein size more than 30 mm is considered in case of the portal hypertension. Also, there is the reversal of the flow in case of the portal hypertension in the portal vein on color Doppler study. Also, multiple varices are noted on the spleen. Splenic varices are also noted in case of the portal hypertension. So this is case of the portal hypertension. In the end, I would like to show you the normal radiological anatomy on the ultrasound of the liver. This is the IVC. These are the portal vein. These are right portal vein, left portal vein, and this is the right lobe of the liver. Whole liver is. This is the carotid lobe. Sometimes carotid lobe normal size is less than 35 mm. Sometimes it is enlarged in case of the various diseases like cirrhosis of the liver and in some other diseases. So here is the right lobe of the liver whole. This is the IVC. These are the portal vein, and this is the right lobe of the liver. Left lobe of the liver is not shown. This is the normal anatomy of the ultrasound of the liver.